Hello, my name is Dr. Michael Rolt and I work for Hampshire CAMHS. This is a short workshop on understanding and managing Tourette's and tics. I hope you'll find this useful. It'll include strategies and some resource for you to follow. There are three things that I hope you get out of today's workshop. Firstly, to understand more about tics and Tourette's, the treatment pathway and additional resources available to you and strategies. So what are tics? These are sudden, brief, intermittent sounds, and they're the hallmark of Tourette syndrome. They can range from mild to severe, the severe symptoms significantly interfering with communication, daily functioning, and quality of life. Tics can usually involve movement, motor tics, or sounds, vocal tics. Motor tics usually begin before the vocal tics do, but the spectrum of tics that people experience is diverse. In addition, tics can vary in type, frequency, and severity. They worsen if you're ill, stressed, anxious, tired, or excited. They can even occur during sleep. They wax and wane over time. They tend to worsen in the early teenage years and improve as young people transition into adulthood. They can be consciously suppressed, but this can be very tiring. Tics are classified as simple tics, and these are sudden, brief, repetitive tics, and these involve a limited number of muscle groups. And there are complex tics. These are distinct, coordinated patterns of movements involving several muscle groups. One particular tic is copopraxia, which is consisting of involuntary performing of obscene or forbidden gestures or inappropriate touching. Coprolalia is the involuntary swearing or the involuntary utterance of obscene words or socially inappropriate or derogatory remarks. However, coprolalia is relatively rare, occurring in only 1 or 2 in 10, and is not required for a diagnosis, and does not persist in many cases. Echolalia is the repetition of words spoken by others, whereas palilalia is the automatic repetition of your own words. To be diagnosed with Tourette syndrome, there are a number of criteria that need to be reached. There needs to be at least 2 motor tics and 1 vocal tic. The tics needed to be present for at least 12 months. And the tics need to have begun before the age of 18. But also importantly, the tics are thought not to occur due to a reaction to medication or through any other physical health presentation. Tic-like movements caused by other difficulties are known as stereotypies, and stereotypies are repetitive movements or sounds. These might include simple movements such as body rocking, head nodding, finger tapping, or more complex movements such as arm and hand flapping, waving and pacing, and these can be associated with many other difficulties. The exact cause of Tourette syndrome isn't known. It's a complex disorder, likely caused by a combination of inherited or genetic and environmental factors. Chemicals in the brain that transmit nerve impulses, neurotransmitters, including dopamine and serotonin, may play a role. Risk factors for Tourette syndrome include having a family history of Tourette syndrome or other tic disorders. This might increase the risk of developing Tourette syndrome. Biological sex. Males are 3 to 4 times more likely than females to develop Tourette syndrome. Here we can see a graph that illustrates the changeability of Tourette's over time. As you can see, it often arises early on, around about 5 years old. It reaches a peak around about 10 years old. And then as the young person approaches into adulthood, we see the frequency and severity of tics reducing slowly over time. The Tourette iceberg is a metaphor we use to describe the complex and varied nature of Tourette syndrome. Like an iceberg, only a small proportion of the symptoms are visible to the outside observer, while the majority of symptoms remain hidden beneath the surface. The visible symptoms of Tourette's typically include motor and vocal tics, which are the sudden repetitive movements and sounds. However, the Tourette iceberg suggests there are many other symptoms of TS that are not immediately apparent, including sensory processing difficulties, anxiety, depression, obsessional compulsive behaviours, ADHD, sleep disorders, and other related conditions. The iceberg serves as a reminder that with people with Tourette's may experience a wide range of challenges beyond just their visible tics. It is also important to recognise and address these underlying symptoms in order to provide the best possible care for individuals with Tourette's. Tics and associated symptoms in these conditions may range from mild, inconsequential, to moderate and severe, and are disabling in some cases. Indeed, many individuals with tic disorders do not need or seek treatment, while others may require multiple therapeutic interventions to manage tics and symptoms of these co-occurring conditions. Treatment is considered when tics are painful or distressing, interfere with social, academic or professional life. When needed, treatment strategies for all tic disorders are the same and may include medication and/or behavioural intervention. Individuals with tics often have co-occurring mental health difficulties, most commonly OCD, obsessive compulsive disorder, or ADHD, attention deficit hyperactivity disorder. In fact, among children diagnosed with Tourette's, 86% have a co-occurring difficulty. 30 to 60% have ADHD, 30 to 40% OCD. Anxiety disorders, 25 to 30%. Conduct disorders or oppositional disorders, 10 to 30%. And autism, 5%. And 23% can have specific learning difficulties. Before I move on to discussing the treatment pathway for Tourette syndrome, I just wanted to briefly talk about a relatively new phenomenon called functional tics. Functional tics, unlike Tourette syndrome, are typically associated with teenage females. The typical Tourette syndrome is associated with much younger males. And there was a rapid onset of tics during the COVID pandemic. It's been theorised that this functional tic phenomenon is associated with the anxieties that came with the COVID pandemic. Functional tics are also different in their presentation to Tourette's. Functional tics tend to be large amplitude movements, often rendering the young person incapable of walking or moving. There is also another association with functional tics, and that is with the social media site TikTok. The presentation of young women with this rapid onset of tic is often very similar to the presentation of content creators within tics. In fact, the hashtag tics or Tourette's has been viewed over 5 billion times. There are strong commonalities between the presentation of the content providers' tic presentation and the young people themselves. Obviously, this is a relatively new phenomenon with lots of research happening. But the important thing to understand is that the treatment pathway is slightly different. The current thinking is that functional tics require a different approach, focusing on low mood and focusing on anxiety. As such, we would use more typical modalities such as cognitive behavioural therapy. So now we'll go on to consider what treatments there are available for young people with Tourette's. Here we have the process diagram explaining how we treat people and how we make the decisions the type of treatment they receive. The first stage is a basic physical health screen with your GP. This is to make sure that we can exclude very rare other movement disorders that may look like tics. The GP can then signpost families to organisations that provide psychoeducation and support. If a young person goes to a school with a MHST, a mental health service team, they can now also provide low-intensity interventions for tics. For those young people with more severe or more frequent tic presentations that reach CAMHS threshold, they'll be referred in to CAMHS. If a young person reaches CAMHS threshold, the two main therapeutic interventions for tics and Tourette's are CBIT, which is the Comprehensive Behavioural Intervention for Tourette's, or ERP, Exposure Response Prevention. If a young person does not respond to either of these techniques, we may well then escalate for a medication solution. In the very rare cases that young people are resistant to the medication as well, there may be a referral to Tier 4 specialist services. The primary technique for treating Tourette's is known as CBIT, the Comprehensive Behavioural Intervention for Tourette's. The components of CBIT include psychoeducation, a functional assessment, and a formulation based on the person's unique difficulties. Based upon this, an intervention is created and individualised. This component involves psychoeducation and habit reversal. Therapists try to reduce blame, stigma, and negative feelings associated with the symptoms. The functional assessment assesses the contextual variables that influence tic expression, and based on these functional results, the interventions are designed to understand and manage the antecedents and the consequences that worsen tic severity. Finally, therapists use habit reversal therapy to teach the client of a specific way of recognising and controlling tics when they occur. Although tic disorders have a neurological basis, the environment plays a significant role in tic expression. These contextual variables are believed to interact with the biological processes to help explain variability in tics. Broadly speaking, these contextual variables impact tic expression, and they can be broken down into triggers and consequences. Triggers are external or internal events that occur immediately before a tic and that change the likelihood of a tic occurring. Settings, activities, and other people are examples of these external triggers. A setting could be school, home, a friend's house, being out in public. Other examples would be participating in an activity that takes all your attention, like sport or music. Some people are triggered by the reactions of others to their tics. If they are told off for ticking or teased for ticking, this can increase their tic frequency. Interestingly, one study reports that over 90% of individuals reported that watching television or playing video games triggered tics. Also, it showed that completing homework and being in class exacerbated tics in over 80% of children. But interestingly, playing musical instruments and listening to music can actually reduce tics significantly. Similarly, I'm working with a young person whose tics completely disappear whilst they're trampolining, and they report that tics can reduce for some time afterwards. Triggering events are individual. Some young people are triggered by watching TV, being alone. Some are triggered by being in social situations. Some are triggered by being upset or anxious or bored. They can be triggered by stressful life events. They can be triggered by hearing others cough. They could be triggered by just talking about tics. So it's really important to understand a young person's individual triggers to enable to design a therapeutic intervention that works for them. A tic is made up of a few components. The premonitory urge or tic signal is an itchy feeling, a tension, a tightness, a tingle. It's aversive. The tics are performed in response to these to relieve the feeling of discomfort. It's a form of negative reinforcement. Negative reinforcement occurs when something is unpleasant or uncomfortable is removed or taken away. And this will increase the likelihood of the behaviour that took the uncomfortable feeling away. So performing the tic reinforces the tic, and as such it becomes a habit over time. Examples of premonitory sensations include a burning feeling in the eyes before blinking, a dry or sore throat before grunting, an itchy joint or muscle before jerking. Tics may bounce back after being suppressed. Some young people will suppress ticking at school, only to have a severe tic attack once they get home. Tic suppression will also improve with age. There is a complex relationship between a young person's emotional state, the environment that they're in, their need to tic, and the responses they get to their ticking. As an example, in school, a young person may feel anxious that they may tic and be bullied or teased. That increase in anxiety may increase the number of premonitory urges they get. With an increase in the premonitory urges, it's much more likely they will tic. And if they do tic, they may get negative feedback from their friends or even teachers at school, which will increase their anxiety, which increases their premonitory urges and their need to tic. So there can be a positive feedback cycle based on the context, their emotional state, and the environment in which they're in, and also importantly, any responses they have to them ticking. As part of habit reversal training, the key element is competing response training. This is where a young person learns to do a behaviour instead of the tic. And what is a good competing response? A repeating response blocks the tic from being enacted. A competing response is less of a problem or less obvious than the original tic, and a competing response can be held or performed for a minute or until the premonitory urge disappears. Competing responses, for example, tongue clicking is a very common tic. However, if we push the tongue to the top of our mouth and breathe through our mouth, it is impossible to do the tongue clicking after feeling the premonitory urge. And in vocal tics, sniffing is very common. However, slow breathing in and out of your mouth is impossible to enact the sniffing tic. So put simply, what habit reversal training teaches the young person is that when they're feeling their premonitory urge, instead of doing the original tic, they perform a competing response instead. Let's have a look at some strategies that research suggests can help young people. Thinking about parents. Managing tics in a child with Tourette's requires a combination of understanding, patience, and supportive strategies. And here are some parent strategies for managing tics. It's really important to foster open communication. Encourage your child to talk about their tics. Create a safe space for open discussions without judgment. Listen actively and empathise with their experiences. Collaborate with professionals. Consult with healthcare professionals such as paediatricians or neurologists. Consult with third sector specialists, such as Tourette's Action. Seek guidance from teachers and school staff to create a supportive environment. Explore potential therapy options like behavioural therapy or counselling. Help develop coping mechanisms. So teach your child relaxation techniques such as deep breathing and mindfulness to help manage their stress. Identify and practice diversion strategies for redirecting their attention during tic episodes. Promote healthy lifestyle habits. Encourage your child to maintain a healthy lifestyle through regular exercise, a balanced diet, and adequate sleep. These factors can positively influence overall well-being and may have a beneficial impact on tic management. Promote self-advocacy. As your child grows older, encourage them to understand their condition and advocate for themselves. Teach them how to explain Tourette's to others and communicate their needs effectively. And celebrate achievements. Recognise and celebrate your child's achievements, both big and small. Positive reinforcement can boost their self-esteem and help them navigate the challenges associated with Tourette's syndrome. Remember, every child with Tourette's is unique, so it's essential to tailor these strategies to your child's specific needs and preferences. Additionally, staying connected with support groups and other families dealing with Tourette's can provide valuable insights and emotional support for parents. It's important for parents to create a supportive environment. So this can be education and awareness. Learn about Tourette's syndrome, its symptoms, and the impact it can have on your child. Understanding the condition is the first step in providing effective support. Educate family members, friends, and teachers about tics. Promote understanding to reduce stigma and misconceptions. Foster an inclusive environment that encourages acceptance. Positive enforcement, so acknowledge and celebrate your child's achievements. Focus on strengths rather than limitations. Encourage a positive mindset to build resilience. Empower your child. Involve your child in decision-making about their care. Build their self-advocacy skills to express their needs and preferences. Encourage participation in activities they enjoy to boost self-confidence. Avoid drawing attention, so help your child feel more comfortable in social situations by avoiding drawing unnecessary attention to their tics. Establishing routines. Create consistent daily routines for your child. Predictability and structure can help reduce anxiety and stress, which may, in turn, minimize tic frequency and intensity. And here are some resources that provide psychoeducation for the young person and the parent. These include Tourette's Action, a third sector organisation in the UK. The Great Ormond Street has a specialist tic and Tourette service. Leaky Brakes, a toolbox online. It's really important to think about schools and how they can help support young people with Tourette's. Teachers play a crucial role in creating a supportive and inclusive learning environment for students with Tourette's syndrome. Here are some strategies that teachers can employ to manage tics in the classroom. These slides aim to provide a brief overview of strategies for supporting students in the school environment and emphasise the importance of creating inclusivity and understanding in the school culture. This includes understanding tics and their impact. It's important for teachers to be aware what are tics, to briefly explain to others that they are these involuntary repetitive movements, to learn about Tourette syndrome and its manifestations to better understand students' needs, to understand the prevalence rate, highlight that tics are relatively common in school-aged children, to understand the impact on education, how tics can sometimes interfere with a child's academic performance, their social interactions, and how it impacts their overall well-being. Tics can disrupt the classroom environment, especially if they are loud or frequent. This disruption may affect not only the student with tics, but also their classmates and the teacher. Tics can draw attention and may lead to social challenges. Students with noticeable tics might experience teasing, bullying, or social isolation. Peers may not fully understand the nature of tics, leading to misunderstandings. Tics can sometimes interfere with concentration and focus, potentially affecting academic performance. Students may find it challenging to concentrate during exams or while completing assignments. The social challenges and potential negative reactions from peers can impact a student's emotional well-being. They may experience stress, anxiety, or feelings of self-consciousness. A constant awareness of tics and their impact on social interactions can affect a student's self-esteem. Educators and peers need to create a supportive environment to boost self-confidence. It's important to educate staff, providing training to teachers and staff about tics, emphasising the importance of awareness and understanding. Schools with a mental health support team, they have mental health practitioners, have received support to provide training within the school environment. So it's important to work collaboratively with the school support team, including special education staff and counsellors. Thinking about individualised support, work with the child's parents and healthcare professionals to develop individualised plans that address the unique needs of the student. Establish open communication with the student and their parents to understand specific triggers or accommodations needed. Making classroom adjustments. Discuss practical strategies for making classroom adjustments, such as providing a quiet space for the student to take breaks if needed, allowing for flexibility in movement, implementing signals for when the student needs to step out briefly. Allow the student to take breaks when needed to manage tics and reduce stress. Arrange the classroom setting to accommodate the student's needs. Consider placing them in a location where they can move without disrupting the class. Allow student opportunities to move around, take short breaks, to release pent-up energy and manage tics discreetly. Develop a non-verbal system so that the student can discreetly communicate to the teacher if they require a break or assistance without drawing attention to their tics. It's important to promote awareness, encourage open conversations, to reduce stigma and increase awareness amongst students, teachers and parents. Peer education. Implement programs that educate students about tics, fostering empathy and understanding amongst peers. Educate classmates about Tourette's to foster understanding and reduce stigma. Create a safe and supportive classroom atmosphere that emphasises tolerance and acceptance. Address questions from students to dispel myths and misconceptions. Creating support networks. Establish support networks within the school community to provide resources and assistance for both the child with tics and their parents. This may include a designated point of contact or support group. Implementing a buddy system, pairing the student with a supportive classmate who can assist when necessary. By implementing these strategies, teachers can contribute to a positive and inclusive environment that supports students with Tourette syndrome in their academic and their social development. I hope you found that workshop useful. For more information, we recommend that you follow the Hampshire CAMHS website for Tics and Tourette's.